Sitting in on the webinar today. My name is Robin. I'm Executive Director for SAOT, and we wanted to offer this webinar on prescription to get active, as we have recently endorsed the program in a similar way to our endorsement of the Prescription for Nature program. So we will have some time for questions and answers at the end. So I just ask if you could please post any questions that you have in the chat box, and then I will let Jeff answer that at the end of his presentation. So welcome, Jeff. Great to have you with us.
Well, great, Robin. Thanks for having me, and thank you to everyone for taking your time. I know your time is valuable to hear more about prescription to get active and the relationship that we want to develop with the occupational therapists across Alberta. I have a presentation set up, and my understanding is about a 45-minute presentation. And so what I'll do to get started, and I don't mean to start this off on a negative note, but I want to show you a really powerful video that was done by the Heart and Stroke Foundation, just to really give us a framework for our conversation today and the problem that I think both our organizations are trying to solve. So I'll play the video, and then I'll go into what the agenda is going to be here shortly. Okay.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
So very powerful video, and really the point is over the past several decades, the physical activity and fitness of Canadians is been on the decline, whereas chronic disease like cardiovascular disease, diabetes, certain types of cancer are increasing to the tune of about 14% per year nationally. And in Alberta, 58% of all deaths are due to chronic disease. And people with chronic diseases are facing a range of negative consequences, including lower quality of life, lower income, and premature death. And as the population of Alberta grows larger and people live longer, the impact of chronic disease on the healthcare system is only going to grow larger. And the silver lining in all this, I think, is that 75% of chronic diseases can be prevented, and that's through research from the Center of Disease Control. So engaging in regular physical activity has been widely accepted as an effective preventative measure for a variety of health risks across all ages, genders, ethnicities, and socioeconomic groups. And I understand that I'm not an occupational therapist myself, but the role of occupational therapy is really to improve the health and well-being of Canadians by working in partnership with people and communities that help them participate more fully in activities that are important to their everyday lives. And one of these important activities is movement and exercise. So over the next 45 minutes, what I'm going to be talking about is really how is prescription to get active connecting healthcare with the recreation fitness industry to really practically address the issues associated with physical inactivity, and how utilizing the prescription to get active tool can support the great work you're doing as OTs to continually improve the health and well-being of Albertans. So this is the game plan. What is Prescription to Get Active? Who are we as an organization? Who do we serve? Why is physical activity important? What's our solution to the physical activity or inactivity problem? And what is the role of the prescriber as you potentially could be? And what is the patient's experience once they get this prescription to get active? What has our success been so far with the program? We've been in operation since 2011. So we've had a number of years of operation to really fine tune our model. And where are we going as an organization? So I'm anticipating that will take us about 45 minutes to go through. So what's our purpose as an organization? I think it's important to really help you understand what is our why. And so our purpose is really to inspire, move, and thrive. So what we believe is that everything that we do, we believe leads to better quality of life for the patients or the participants we serve. And we want them to thrive, not just survive. So we help participants thrive by providing physical activity opportunities that are inspirational, effective, and accessible. And our brand promise, something that we want to aspire to, and we know it's a lofty goal, is that 100% of the participants who register their prescription to get active will still be physically active after a 12-month period of time, and hopefully make that part of their lifestyle. This is what is Prescription to Get Active. So this is really our ecosystem and how we roll. We're funded through the Alberta Health and Alberta Mental Health and Addictions, and we have some smaller sponsorship through Alberta Blue Cross. But essentially, we have memberships with recreation fitness providers. We have agreements with online activity partners, trail route access and maps. And then we are working with community associations to provide no-cost and low-cost programs. So these are what we call our activity partners. And we have our activity partners provide people that get a prescription to get active with free trial periods or free ongoing physical activity opportunities. And so we try to connect our healthcare partners with the fitness and recreation community. And we do that by having arrangements with healthcare professionals, like potentially occupational therapists. And so these healthcare professionals write a prescription to get active. And they, once people get a prescription to get active, then they come to our website and they take a look at many different opportunities in which they can engage in to be more physically active. And we hope that they find something they like, because we know if they like what they're doing, they're more apt to sustain their physical activity over a long period of time. Traditionally, we were known for directing people to recreation facilities and health clubs, and we know that people want to do more, and not everybody's interested in going to gym to do their physical activity. So we've expanded on that. Well, we also recognize that behavior change is hard, and being more physically active in some cases is even harder. So what we've done is we've tried to support people in the following two ways. One is with an online app that enables people to put in their goals, and they are scheduling on a weekly basis, and then they get messages, and it may say, hey Jeff, I see you got a walking, you're walking tomorrow, get your shoes by the door. So it's a reminder for people to prepare for their activity session. It asks them to record their physical activity, and then if the pro behind the app hasn't seen a person participating for a week or two, they would send out a nice message just trying to motivate them to schedule their physical activity in time to get started again. So it's effective for some, and it's a really interesting tool. I've used it over the last year, and it's helped me continue to be motivated to be physically active. And then lastly, in terms of the behavior, we're doing a study with Lakehead University with volunteer activity coaches. So these are healthcare professionals and fitness and recreation professionals that are specially trained in motivational interviewing. They go through a 2-day intensive workshop on how to use motivational interviewing. And then in the study, people were randomly selected to either get a coach or go through our regular program over a 12-week period. So those folks with the coaches, we've identified preliminarily have a much higher level of self-efficacy, higher motivation levels, and their mental health has improved significantly just from having the coach. But also we've measured this at the 3-month point after the coaching, and then we're going to measure it again at 6 months. So after 3 months, it's still on the rise in terms of people's adherence to being physically active in both streams, having the coach and being self sort of regulated in terms of how they participate in prescription to get active. So that's the high level view of prescription to get active. We're a not-for-profit organization. We're governed by a board of directors, and really our message here is that we have a combination of healthcare professionals and fitness and recreation professionals that support us, and we have a medical doctor on our board that has been of great assistance in terms of navigating the medical system with our program. We also have volunteers. We have over 50 volunteers in Alberta in things we call our chapters. And so we have chapters in Calgary, Edmonton, and the Chinook chapter, and we're expanding that over this year into Northern Alberta. But fundamentally, these are advisors to prescription to get active. Again, both combination of healthcare and fitness and recreation members that really help us tailor the program for the communities that we're in terms of the clinics that we're seeking to be partners with prescription to get active, but also our activity partners as well that are in the community that can provide a benefit to your patients. They vet all the applications that come in from both healthcare members and activity members just to help improve quality or continue to have great quality in terms of the experience that your patients will get when they receive the prescription to get active and redeem it on our website. This is the scope of our operations. So we have, in terms of activity members, and these are fitness and recreation facilities and some online programs, we have 148. And then our healthcare partnerships have really started to boom. We've had about a 20% increase year over year in the last couple of years to 1,038 different clinics. And then we have about 1,700 prescribers that are part of prescription to get active. So who do we serve? We have identified that the population that is really benefiting from prescription to get active so far is being women. 68% of the people who register the prescription are female. 81% are adults, although we've seen a pretty rapid increase on the bookends in terms of older adults. That's doubled in the last year, and also children and youth has gone up significantly as well. So we can accommodate really anyone in the population when it comes to their physical activity needs. And then 40% of the people who have registered have declared themselves as low income. And this is really important because low income earners just don't have the same health equity when it comes to access to the healthcare system, but also that holds true in terms of fitness and recreation as well. So we're quite conscious that we want to service the needs of this specific population. Excuse me. So why physical activity? I know I'm talking to experts in the area of physical activity, but this is just an important point in terms of the magnitude of the benefit of risk reduction with physical activity. On the left-hand side, you'll notice the condition in terms of chronic conditions, and by no means is this an exhaustive list, but you can see some of the heavy hitters here in terms of cardiovascular disease. And what this is saying is that physical activity can reduce the risk of cardiovascular disease by between 33% and as high as 50%. So people who are, as adults, physically active up to, say, 150 minutes, so moderate to vigorous per week, they can notice a decrease in their risk of cardiovascular disease by 33%. And if they're more physically active, more fit, that can go up in terms of risk reduction of much as 50%. So it's really compelling in terms of the work that you do, in terms of the work that we do to try and get people moving and exercising. And on the mental health side, in terms of some research I've done with the CANMAT, the Canadian Network for Mood and Anxiety Treatment, they've indicated that physical activity is a primary form of treatment for mild to moderate depression, and physical activity is used as an effective adjunct in other more severe forms of mental illness as well. So on the topic of mental health, this is just because I know there's some mental health folks on the webinar. Exercise really at the most fundamental level, once people go out and start their walk, there's a release of chemicals in your brain that really make you feel better about yourself and about being outside. So that's the release of serotonin and dopamine, all the way through these benefits to having some physiological change in your brain to really enhance people's memory, enhances the way that they're thinking, their analytical skills, those type of things as well. So there's great benefit both physically and mentally to being more physically active. So what's our solution to getting more people more physically active more often? And prescription to get active is not new. It's new to Canada, but worldwide, many countries have a physical activity prescription. And in Sweden, and they've done a great amount of research, what they've identified is that when a healthcare professional provides their patients with a physical activity prescription, has that conversation, they've noticed that there's about a 62%, and I've seen as high as 65% adherence rate after 6 months to physical activity. And they're having conversations with their patients. They understand their patient's health history. They understand lab results, all those type of things. And more importantly, they've developed a relationship with the patients that I think is led to them really believing that physical activity is an important part of their treatment program. There's been a 20% increase in their activity levels towards 150 minutes per week. And then, of course, their quality of life has improved from that as well. And on the right-hand side, this really just shows the 5 key components of a physical activity prescription model. We've developed our model around this, plus we've done some research within the province to find out what practitioners really want from a physical activity prescription. And so I'll share with you what our model looks like, but all of the models are person-centric, have a written prescription component. They're evidence-based in terms of the recommendations, and they have a supportive environment within a community network. And then there's follow-up done of some form. So there's few models that exist in Canada that work across the issue chain to help prevent and treat disease through physical activity. From really identifying the problems that's done at the prescription level or the referral level with folks like occupational therapists, identifying what the challenges are and how people could possibly benefit, and really getting buy-in from the patients to be involved in physical activity, through to being able to provide value-based physical activity. Not everybody wants to do the same thing, and we believe that if we offer a broad spectrum of physical activities across the physical activity continuum, the better chance we have of people getting involved and sustaining their activity. And then, of course, behavior change. How do we help sustain that physical activity? And I've already mentioned that through the app, the remote behavioral app, and also activity coaching, which we're looking for funding on in terms of the activity coaching program to implement that for everyone to potentially get an activity coach if they want it. So really, this is our solution, and it is a really quite straightforward solution. What we're asking of occupational therapists is to with your patients, ask, assess, and advise. I mean, are they physically active? How many minutes per day? How many days a week? And you'll have learned that through the work that you do with them. And do they need clinical supervision when they leave your care out in the community? So that's really important in terms of that assessment that you do with them. People who need clinical supervision that may have to go into cardiac rehab aren't eligible for our program. So there's some other means for those people to get support. So once it's been identified through your pre-screening and your conversation with the patient or your client, then you can provide a prescription to get active. And this is to help people continue on with the work that you've been doing with them out in their community to help them transition. And so the prescription can be given in a number of different ways. Traditionally, it's given on a tearaway pad. Next, it could be through an EMR if you work within that type of system. But also it can be given verbally if you're meeting with your patients online or over the telephone, and it makes sense for them to be active in the community and they're eligible, then you can simply say, I'm providing you with a prescription to get active. Let them know that you've received this from XYZ clinic, and register your prescription on prescription to get active. And that gives them access to all these different opportunities that I'll share with you in a moment. So it's that's straightforward. And so it's that's the beauty of prescription to get active, is it's not complicated. And it's really used as a support tool for the great work that you guys are doing. I've already mentioned who's eligible for the prescription to get active. And the point that I didn't highlight was these folks are low risk, or they're medically stable and free of unstable chronic conditions and disease. So who can prescribe or refer? So traditionally, we've had medical doctors, nurse practitioners for many years, and their allied health professionals that were part of a dedicated practice relationship be prescribers for prescription to get active. And these are folks that, if they're allied health professionals, have shared medical records. They have communication between the prescriber, which is the doctor or nurse practitioner, and that there's doctor program oversight and accountability for patient care that's provided to the allied healthcare professionals. And what we've noticed is that by having that, it's worked not too bad so far, but it's really created a barrier in terms of, when you have a patient in front of you and you believe this is a real benefit in terms of them being more physically active through our program, having to either have a conversation with the physician or nurse practitioner, having to go into their medical records when you've already done an evidence-based assessment to know that they're physically active, and you can just basically prescribe the prescription to get active, is a much easier way to go. And so we've developed a new prescriber policy with our board, and we've worked with the college to really identify that with occupational therapists, it's within your scope of practice to refer physical activity, and it's also within your scope of practice to provide a evidence-based pre-screening tool. And I understand that many have that. If you need a recommendation for a pre-screening tool, we have that as well that I'll show you in a minute. So we're thrilled that we're trying to break down barriers for more people to get these prescriptions to get active by working with more regulated healthcare professionals in the province to work independently of that dedicated practice relationship here. So this is just a snapshot of the two pre-screening tools that were recommended that are evidence-based. The PARQ Plus, which you may be very familiar with, has been used for a number of years. You may have your own assessment tool that goes even deeper than the PARQ Plus, but it's fairly straightforward to use. It's made to be a self-assessment tool for individuals. It's online. It can be done electronically, and they can bring you a copy if they want to do something in advance, or if they want to do it right there. It doesn't take very long to do. And then there's a Get Active questionnaire that was done through the Canadian Society of Exercise Physiology. That is another good tool. We find that just through some, I guess, getting some feedback from healthcare professionals on which tool they thought was easiest to use. They picked the PARQ Plus, but it depends on who you are and what you're used to seeing. And this is just a snapshot of the PARQ Plus form. There's 7 questions on the front, and if people answer no to these questions, then of course they can move on and you can provide the prescription to get active. If they answer yes to any one or more of these questions, there's a second page that further vets them in terms of being able to be physically active. And if there's still yeses to the second page, then either they can do another questionnaire, or you can just simply refer them to their physician or nurse practitioner to get clearance to be physically active. So what's the prescriber role? What would your role be? We have a toolkit. We have a training video on how to administer the prescription to get active. It is admittedly built for physicians who have very little time. Occupational therapists have possibly a very different skill set in terms of when it comes to exercise and promoting physical activity that you're absolutely able to use in your consultation process. We have a process map that is really just the foundation of prescribing the prescription to get active. And again, you can put in your own skills and counseling skills into that. We provide within the toolkit the pads that can be used. We can provide a starter kit to start, and then once the pads are gone, it's really up to that organization's responsibility to get more pads printed and the expense for that. We just don't have the budget. We've got a cheat sheet on how to get into the EMRs to access our form in case you are using that and need that. We have some marketing materials that we can provide. And then there's potentially some supplemental training if needed. I don't imagine that this group does, but we work with Exercise Medicine, who has doctors that train doctors in terms of the benefits of physical activity and how to prescribe in more detail. But we've really never had anyone access that additional training at this time, but it is available. So I won't go into the video. This is just a look at the toolkit. So this is the process map. Really, it just highlights the things that I've already mentioned in these areas. And it's so important that people register their prescription with Prescription to Get Active, and I'll show you that in a moment. And then if you can at all possible, follow up and ask the patient how they're making out with their new physical activity routine, because that goes a long way. It's not mandatory, but it is impactful in terms of getting people to adhere. And this is just a sample of the EMR access form, just a high-level way to get into those EMRs and get access to the form. And here's what our prescription pad looks like at this point. We're going to be changing it down the road, but we don't ask for any healthcare information, just basically the date, the patient's name, the provider name, which would be the OT, and then the clinic name where they're getting the prescription from, and whether they're a child or adult, and then how they can register on our website. If people they don't have an email, they're not good at using the computer or comfortable, they can call me and I can help them navigate what's available to them to help them get on their way with being more active. The QR code here goes right to our website, to our homepage, where they're able to register. In our new prescription form, we're going to highlight and emphasize more about the benefits of registering and what they get. And then the QR code will actually go directly to the registration form rather than going to the website homepage and then to the registration form. And this is just a sample of some of the posters that we have in the toolkit that either you could print, or we have a small supply here that we could provide as well. And essentially, it's just creating awareness about the Prescription to Get Active program. And then the QR code takes the patient to a 1-minute short video, and they may be looking at this in the waiting room or in the treatment room. And they can sort of identify, hey, this sounds like a good program, and they can ask you a little bit more about that simply as a form of awareness. And this is the video that I won't show you now, but it's part of the toolkit, and you can take a look at that if you're interested. Okay, so implementing a successful RxTGA program is very simple. The technical parts are really ensure that you can access the RxTGA form, that you have those forms printed and available in the tearaway pads. You can access through the EMR if that's what you're able to use. And then again, with the virtual prescription, just identifying that they're getting a prescription to get active, and for them to register and identify the clinic name. And then promote, hang the posters. We have some videos if you need them that can go up on television monitors. And then finally, the reporting part. And we put a hold on the reporting part because it's been very difficult, especially during COVID, with healthcare professionals to be able to count the number of prescriptions that are written. And we're redesigning the prescription pad to make it so that you don't have to record. So that's on hold for now. But if we get to a point where we need this done, it really is just counting the number of prescriptions that are written every quarter, and then just letting us know how many were written. So how do you become a prescriber or refer the prescription to get active? So currently, if you're part of a primary care network or Alberta Health Services, you don't have to do a tremendous amount of paperwork. Not that there is a lot, but you can, if you're part of a primary care network, you can simply talk to the clinic and identify if they're already a member prescription to get active, and then you can be a prescriber. Departments like Alberta Health Services, if you have we have an umbrella agreement with Alberta Health Services that they want you to review. And then they want you to sign an addendum to the agreement. So what that means is that you would provide us with the application form for your department. It may be occupational therapy department. And then we have that go through the chapter, go through the board, and then we send that to Alberta Health Services once it's been approved. And then they work with you to have the signing of that addendum, and then we go through an orientation with you of basically very similar to what I'm doing now, how to implement the prescription to get active. If you're not part of those two organizations and you're part of an independent clinic, or you're an independent contractor, and have your own business, then on behalf of the organization, you make the application. And it's on our website. There's a link, and then the application is vetted through our local chapter and our board. If it's approved, then we send you a membership agreement. Once that gets signed, then there's an orientation to how to prescribe and making sure that you feel comfortable with prescribing and what that means. So at this point, Robin, I'm going to stop here. I'd like to share our website with the group just to show them the value that their patients would get by registering their prescription. Is there any questions that have maybe come up in the chat about how to be a prescriber, what that all means, that type of thing? Okay, so I'm going to try to stop sharing this. Just trying to escape. And I'm going to stop sharing this. And just bear with me. I'm just going behind the scenes to open up our homepage. And I'll share my screen again. So Rob, can you give me the thumbs up when you can see our homepage, Filipino Family Walking in a Park? Okay. So once people receive the prescription to you and you ask them to register, they come to our website. They can either take a look around. We don't have a ton on our website on the front page because we want to make it very simple for people. But if they want to know what is this thing, what's available to them, they can watch a video. How does prescription get active work, exploring their options. And if they don't have a prescriber and they just stumbled on our website, they'll be able to search a map to find out who is providing the prescription to get active in their area. And this would be similar for occupational therapists who want to be members of Prescription to Get Active. We would put you on our website so that people will be able to easily find you. So the registration form is pretty straightforward. We don't ask for health history. We ask for their name, their email address, postal code, phone number. We ask them to put in a password that we don't see so that they can set up an account so they can easily get into the back end of our website to see what's available to them, and they can come and go and try many different things over time. We ask them to identify where they've got their prescription from, and they start typing, and that would come up. And then we ask them to, if we can communicate with them, our terms of service, which really talks about the inherent risks of physical activity and that this prescription is specifically for them. They shouldn't share this with a family member or friend because they're not the ones that have been assessed by a healthcare professional, and we want to keep it safe for everybody. And then just by checking this box, they agree that this is a legal equivalent to a manual signature, so they don't have to scan anything and send it off. And once they've filled out that information, they click on submit, and then I'll take you to where they go from here. So I won't fill all this out, but what I will do is I'll sign in, and this is what shows up after they've gone through the registration. And here's where they land. So they can see everything that's available to them on one page. And the key here is that all these different opportunities are available to them. If they decide that they want to try a fitness facility and that didn't work out for them, or they wanted to do something else at the same time, they can absolutely do so. And we explain that in this video here about really how they can navigate this participant dashboard. So I'll just go through some of the areas here. Support, this is done through a company called Go Get Fit. Dr. Peter Rollick, ER doctor out of Red Deer, maybe some of you have heard of him. He's got a remote behavioral support app that people can put in their goals, they can put in their schedules, and I've mentioned this at the beginning. It works pretty good for many. Facility trials, once you hover over each of these, it gives you what really people get here. And if they want to find a facility near them and gain access to something, they can do so by just clicking down, usually in the right-hand side here. We have online programs. We've vetted our online providers. They're some of the best in the industry in terms of qualifications of teaching classes. We have Wellness Solutions out of Australia that provides thousands of different video on demand classes from yoga to boxing to there could be higher intensity activities. You can do yoga on the beach of Bali. It's really quite slick, and you can do 5-minute, 10-minute, and 30-minute type of exercise routines. And they're really catered to either beginner, intermediate folks. And you can filter it by instructor as well. If you tend to gravitate towards one instructor, you can filter it by them, and it'll show you all the programs that they teach. We have a relationship with All Trails, and full disclosure, anyone can get free access to the basic version of All Trails, and that's no different for us. We just make it easy for people to access through our website so they can discover trails around them, or if they're traveling somewhere that are really going to be appropriate for their level of readiness or fitness. We have an evidence-based resource library that people can print off for free all kinds of information. There's a Get Starting Guide that's a really great walking program over 6 weeks that progresses people effectively through weeks 1 through 6 in terms of the amount of physical activity that they're doing. It talks about the warm-up, the cool down. And then we have a tab here called Special Offers, and this basically will be making people aware that there are fee assistance programs out there for people that can't afford and they go through, say, a trial at a fitness facility, and they just don't think they can pay for the monthly dues if they want to continue. Then many of the municipalities, the YMCAs, have fee assistance programs, and people would have to qualify for that, as you probably know. But we just want to make them aware that they should explore those options as well. But we have many free things on here. The trials are free with fitness facilities and online. We've got agreements with these organizations that they're not to take any credit card information, and they're not to hound people for membership. If people don't want to continue on after their facility trial, they don't have to, and they don't have to worry about people getting back to them and saying, hey, you need to join and do something here. That's not part of the equation. So we want to make it very safe for people to come through a program. And the whole idea is for them to try something, find something that they like. So hopefully they continue on with physical activity as a lifelong type of endeavor. I'll just give you an example of, I'm just looking at the time, Robin. How am I doing?
You have 3 questions so far.
Sure. So I'll wrap it up quickly here. Excuse me. So under facility trials, as an example, people are able to find a facility near them. They can go through this and scroll down if they want to get to the map, or they can just jump to the facilities map. And basically, you can enter your city here, and I'll show you how this works. It will populate with some green dots who our partners are that will accept the prescription to get active and provide the free trials. We can do it also by activities, where people can indicate what city or town they're in. And if they want to do badminton, then that will come up. And then if they want to filter by type of organization, say they're more interested in a municipal organization, they can filter that here as well. And they can search by locations if they're aware of maybe someone in the community and want to see if they're a member of Prescription to Get Active, they can do that too. So I'm going to plug in Edmonton, and you can narrow down or broaden the search radius here. And this basically brings up all of these green dots are members that we have that have signed our membership agreement with Prescription to Get Active. You can hover over each of these dots and you can identify, where are these places? I live in Fort Saskatchewan, so what's available to me? I'll just click on the Dow Center. On the right-hand side, it gives the address, it gives the offer that they're providing. You can get more detail. And there's a little marketing piece here from the Dow Center and the activities that people are able to do at the Dow Center as well. So it's as simple as that. We could also narrow down by, say, badminton, and that will narrow down the dots just to include those groups that have badminton. So I'll stop sharing there, and then I'm more than happy to answer any questions that there are.
Prescribing limited to therapists who are connected to MDs or NPs.
So, and I apologize for the misunderstanding. So we're broadening that so that therapists that are regulated therapists don't have to be. And that's by doing a pre-screening tool, an evidence-based pre-screening tool, and filling out a membership agreement, or their organization fills out a membership agreement. So they don't have to be connected to an MD or nurse practitioner. So hopefully that clarifies that.
Interested in becoming a prescriber but would like to trial it for themselves. Can they sign up themselves without a prescription? And this person is an OT within AHS.
Yeah, what you can do is, if you want to sort of experience our website and those activities, you can do that. We just ask you to register with your information and then put behind your last name test. So we take you out of our numbers, and then you can come and you can take a look around and see what's available for you that way.
Locations for the facility trials.
That was identified through that map. So hopefully I've answered that. So you would be able to go into that map and be able to put in where you live, and it will come up and populate with green dots on the map what facility locations there are. So hopefully that answers that question.
In your program and the Parks prescription, any collaboration with Parks Canada?
Yeah, so there's not. I mean, we fully support what the Exercise for Nature is doing. We want people to get out and be active in any way that's meaningful to them. We've talked to Prescription for Nature to see if we could collaborate on some things, and they, basically wanted to go their own route with their own prescription, that type of thing. So, but if what we agreed to is if they have a specific program that they wanted us to maybe communicate, endorse in terms of a special event or whatever, we do that. We haven't had that yet, but we fully support what they do, but their prescription is different than ours.
Prescribing the use of walking poles or Nordic poles for clients who have pain issues. Have you considered including pole walking or trials of walking poles under your resources tab?
To be honest, we haven't, so that's great. If that OT wants to connect with me and give me some more information, I'd be more than happy to have that conversation to see what we could do. But absolutely, if that would be a benefit to many people, we could put it on our resource library as long as it's the information's evidence-based and you trust it, and we get permission to have people print it, then that would be it'd be something that we would certainly look at. They can, but under a dedicated practice relationship, because they're not registered and governed by the Health Professionals Act. They need to be under a dedicated practice relationship. So we do have a number of recreational therapists that are part of that within AHS that are prescribers. So you have, you can be, but they can't be prescribers independently like a regulated healthcare professional can, like the occupational therapists.
Of free trials people can access?
Interesting. Yeah, I would say that when people show their prescription to, say, a recreation facility, and they go through a free trial and they decide that it's not for them, they can't go back and get another prescription and come to that same facility and say, hey, I want another free trial. It's not a fee assistance program. It's really to expose them to different options to help them get physically active. What they can do, if they came back to you and said, hey, that didn't work for me, can I get another prescription and go to, say they went to the city of Edmonton and they wanted to try Good Life or Gym Movement, they can do that. So they can redeem them at different organizations, but not the same one within a year. And they can come to our website and do the free trials of online stuff as much as they want to do. They can do the resource library. There's no limit to those type of things as well. So we encourage people to come and go and try different things. So hopefully something sticks for them.
Great. And what is the typical facility trial? For example, is it 2 to 3 passes?
Yeah, it's really across the board. I mean, the city of Edmonton offers a 3-visit free trial. We've talked to them about that. They're looking at maybe increasing that, because we know if people are using it a little bit more and develop a relationship with the staff and get to meet people there, it's more effective in terms of adherence. It really ranges from 3 up to a month free trial. And then I think typically we have 10-visit passes with most organizations, but it really does run the gamut that way. I would say typically it's more so on the 10 visit plus, to a month.
Registration and accessing the website?
No. Oh, sorry, for individuals, for participants, there's not. So as soon as they register, right away when they hit submit, it automatically takes them to that participant dashboard where I showed you the circles of the pictures of what they have to access. There's no lag time. They will receive an auto response from us saying welcome to the program, and they can also use that auto response as proof that they've registered their prescription. So if you've given a prescription verbally and they register, then they have something in hand to take facilities to facilities, and they don't really need a piece of paper to do online or access a resource library at all. So
And we will sign off. From an OT working in acute care, often referring patients to community programs. Can we be a prescriber even if we won't be following them after their discharge from hospital?
absolutely, and that's really the essence of our program. We want to make this easy for OTs in terms of we vetted all of our partners so that you can trust that people are going to get a good experience when they go out into the community, whatever they try on our website. But we want to provide this as a tool for you so you don't have to go out and find those options for people to do. We're really trying to do that for you. Not to say that you can't make recommendations, absolutely, but we want to make it, we want to reduce your workload and make it easy for you to keep on doing the great work you're doing.
The application to become a prescriber, and also a question about whether or not you would send me a copy of your slides so that I can get those out to people as well.
Certainly. So slides, and I'm just working on the link here. Just give me a second. And it's right on our webpage, but I'll try and make it easier here. Bear with me. Copy that. I'll just put it in the chat here. Okay, so that's there. It's on our website as well, right from the homepage in the menu. If you go to partners, then you can scroll down a little bit and under healthcare, and you'll see this as well. But I'll put also in the chat my email address.
Sure.
At alberta@prescriptionactive.com. There you have it.
Great.
Good.
Okay, and I'm just going to squeeze in one last question that's popped up, Jeff. So just for clarification, the only way to see the facilities is to get on as a test subject, or could a person just go and take a look without that?
So when you say a person, are you talking about the occupational therapists, or are you
Yes.
talking? Yeah. So all of our, I shouldn't say all, most of our partners are more than willing for you to come in and take a look just to make sure that they have the equipment or it's appropriate for your participants. I would say you just have to come in and ask, say, I'm an OT, I'm just trying to check out your facilities and want to know what you have. And they would probably get you sign a waiver form in case you trip. But as far as I understand, most of them are more than open to that. And what we understand is that if you come in with your patient, maybe you prescribe them with a prescription and they want to go to the Dow Center, you can approach the Dow Center and just say, hey, I want to introduce my client to your facility. We've been doing some work together, and usually they're very accommodating when it comes to having a therapist come in, at least for the first session, to show them what equipment would be appropriate, but also to introduce them maybe to the staff person just to make sure that they're comfortable. So I won't promise that all will do that, but I've never had anyone say that they've been turned down to do that or take that approach.
Okay, perfect. Well, thank you so much, Jeff. It's really good for everybody to get up to speed on this initiative. And so we really appreciate you sharing the information.
You're welcome, and thank you so much for your time again. And my email's down there and the application. So please give me a call if you have any more questions. Thank you.
Thanks so much. Have a good afternoon, everyone.